Welcome to this back health masterclass. We've got a lot of information that we're going to be going through today in this sort of presentation. So I'm going to cut straight into it and give you guys an overview of what we're actually going to be discussing first and foremost. And we might have it pop up on the screen underneath me from time to time, just to kind of give you a heads up of where you are along the process. So first and foremost, we're going to be going through your diagnosis. The different diagnoses that might be appropriate for this, etc., and really help get that out of the way first so you know that you're in the right place. Next, we're going to go through why we can help you specifically, experience, etc. And we'll kind of touch on that as well as we go through various parts of the rest of the presentation. Next thing we're going to be going through is the main challenge and why things haven't worked for you so far. Chances are you've tried other things and they haven't worked, dealing with your back pain, your sciatica, whatever the exact symptoms you have. And that's fundamentally why you're here. And there's generally a major sort of catch-all error that people are making. And we need to highlight that first, because at the end of the day, if you go on and do all of the other things that we talk about correctly, and you're still doing those mistakes, it's just going to undermine absolutely everything. Some of you will have been making these mistakes as your primary source of treatment, if you will. Others of you will be doing some of the right things, but some of the wrong things. We need to just get that out of the way first. Next, we're going to go through very briefly the principles. Understand that what we're talking about here and what we talk about in the Back in Shape program in general is principle based. It's about back health. It's about successful rehab. And without these principles, you're not going to have long-term results. Then we get into the practical part. We're going to be demonstrating specific exercises with some specific training points, etc. So make sure you pay attention to that part, but it comes in order, and that's really important. We've got stage one where we're going to be covering relief, not rehabilitation. Stage two, we're going to be talking about building from the ground up, literally starting with you on the ground and building things back up. Stage three is where we're going to be talking about guiding the healing process, building some resilience through the area that is injured in your lower back and helping guide that healing process through the remodeling stage so that the tissues fundamentally become stronger again. This is about getting those lasting results and so very important. Then, to wrap it all up, we're going to talk about this magic principle, if you will. We know that 9 times out of 10, if not more of you, are going to have missed out this principle, and that's why you're here. Even if you've been doing the right sort of things, you need to get this bit right, so make sure you take some notes down at that particular point. And then we're going to kind of wrap it all up and talk about what now, what are the next action steps, what should you be doing going forwards afterwards. So there's going to be a lot. Get yourself comfortable, and I think before we just get into it, and I understand that many of you guys, you're going to be in pain. You're not here because you don't have back pain. And some of you sitting through this might be a little bit uncomfortable, just literally because of your back. So there's a couple of tips here that can hopefully help you. Number one, get yourself an ice pack. Something that can go directly over that lower back, and use it on and off as we're going through this for 3, 4, 5 minutes at a time. Do not leave it on there for 20 minutes, but that's a nice, easy way for you to just calm that lower back down a little bit. Next thing is grab yourself a little towel, something like this, to support you. If you're sat down in a chair watching this, then just to support that natural lordosis in the lower back. I'm going to be using this spine for various points during the presentation today, and that towel is just going to go down here and support that natural, normal lumbar lordosis. Some of you might be a little bit flat down there, but it's just going to support you as you're sat watching. And then the final thing is get up and move around. Please, most of you watching this will be on your smartphone or something like that, tablet, computer. Just get up and move around. Don't sit here for the whole thing. Get up every 15, 20 minutes, something like that, to just move your body. That is such an important principle for the long term, and sitting for extended periods is never going to be good with any manner of back issues, even if it feels pleasant at the time. Get yourself a pen and paper, so we can make some notes, or you can make some notes as we go along, because there's going to be tons of information. You're going to want to get some of this stuff down so you don't forget it or you don't miss some of those important points. And as we get towards the end of this part, getting into the diagnosis side of things, understand that there are no magic exercises. You'll see stuff online saying this magic thing is going to fix you, this one's going to fix you, etc. There are no magic exercises. The information and what we're about to go through is distilled from over 300 video segments within the full Back in Shape program. And that's distilled from tons of additional videos that we've got on our YouTube channel, not to mention the significant experience over the years. And we're talking about thousands and thousands of patients that have kind of culminated in what you're about to go through and the program at large. So the whole thing is important. There are no bits that you want to skip ahead to. And I would encourage, if you're feeling that way, you want to, hey, I want to go over that bit, or I'm interested in that bit, be interested in it all, because we find that those that skip ahead like that, they tend to do the same thing in the program. They tend to be the same ones that have done that over the years in clinic. Yeah, just do that thing for me. And that's a real problem. It's a real failure, and you're missing out on things. And that's ultimately why that particular group of people, you don't do as well. So you please follow through everything because it's all vital. We wouldn't have put it in because I've got to go through it with you guys. It wouldn't be in there if it's not relevant to your back health. Again, this is a masterclass, not just a snippet. It's everything you need to really help you. So let's get into the diagnosis, because ultimately I want you to just get out of the way. Is this for me? Is this for me? I'm not really sure. On the screen in a sec, we're going to have a number of different diagnoses. These are all the different diagnoses that might cause back pain. They might cause leg pain. They might cause hip pain, etc. But they're coming from the lower back. They are lower back injuries that need to be rehabilitated, or it is a, as we sometimes talk about, it is a lumbogenic leg pain, i.e. pain in the leg that is generated from some sort of injury up in here in this lower back. And it could be the disc injury, it could be the spondylolisthesis, it could be a facet injury, it could be any manner of different diagnoses. But the reason I say that and I draw those out is that some of them might not have specific local lower back pain all the time. Some of them, because of the nature of the nerves in this area, might give you referred pain and you have pain in a different location. The point being that all of these diagnoses and many more are, if you've got any of these, you're suitable for what we're about to cover in the program at large. Often people use their diagnosis and say, well, I'm not quite sure. How are things going to be tailored to me? We talk about that too as we go through the presentation. So just keep that in your mind. You might have your specific set of symptoms or diagnoses, and we will cover how things are kind of tweaked and adjusted to your specific experience. One thing I would say is that everybody's different. Everybody does have different challenges that they need to overcome. And I would argue that there is the same, if not more, difference in two people with textbook the same diagnoses. So you might have an L4-5 disc bulge and someone else might have an L4-5 disc bulge. It might be paracentral off to the left, or whatever the specific nuanced term is, but there will often be more difference or equal amount of difference between the two of you with the same diagnoses and that person with the disc diagnosis like you have and some other lumbar injury that they have been diagnosed with. Because quite frankly, it's not the specifics of the diagnosis that we need to work on, but it's why that diagnosis has taken hold. It's why that has taken place. And that is where our uniqueness is investigated and addressed. And I think to close this section here, because it's quite important, with one of our members who's had some great success. And remember, those diagnoses I mentioned earlier, we'll have members with each one of those that have had an absolutely fantastic approach, turning their back pain around and getting results. Now, Janet had a grade 2 spondylolisthesis, and the reason I bring her up is because her story is so impressive that it was featured in UK media outlets. It was in the Chat magazine here in the UK. Whenever you're watching this, it was around about where are we now? Summer of 2023. I've put a link just here. You can see the article, etc. And you can go and read more about Janet's case on our website and a link to the actual publication that was put out in the media. The reason I'm mentioning this is because a grade 2 spondylolisthesis is when these lumbar vertebrae, you should see that they're all stacked over the top of one another. Spondylolisthesis is one of those more severe diagnoses. It basically means that the bones have shifted forwards and they're graded 1, 2, 3, and 4. I won't get into the excessive details here, but suffice to say that 1, 2, 3, 4 is 25, 50, 75, and 100% shifted off out of place, so to speak. Imagine if your knee was 25%, or sorry, 50% with a grade 2, shifted off to the side. We can imagine that would have some serious issues. A grade 2 spondylolisthesis is not a good diagnosis to have. It is a challenging one. And the reason I mention that is that with good work, hard work, consistency, and diligence, with the support that she had going through this process, Janet was able to really turn things around and get back into doing exactly what she wanted to do. You can go and check out that story. We'll link to it elsewhere or after this. You might get an email which will link specifically to the article, etc. So you can go and check that out for yourself. But I say that to say that this approach to helping people with their back pain has helped you no matter what the diagnosis is. You might, and I'll touch on this more later, you might be feeling a little bit disheartened. Hey man, I've tried lots of different things. They haven't worked. It's been very difficult. I don't know if this is going to work for me. The important thing is if you follow the principles, it will work, because it's worked for people just like you, just like Janet, and much worse over the years. You just have to follow the plan and give your body the time it needs to heal. So that brings me to the next point. It's like, well, why can you guys help me? Other people have failed so far. And we used to get this a lot when we had our clinic. So over the years, we've worked with literally 10,000 plus patients. And I'll touch on the specifics of this experience in a later section. But the point is that this program, the approach that we have, the principles that we talk about is based on that specific experience. And we use that to formulate and build and develop that approach, that ethos within our own clinic, the Mayfair Clinic, which was a clinic in central London, and we built that practice, and the success of that was we were awarded the Queen's Award in 2020. You can see the things on the shelf behind me, but I'm also going to link afterwards in that email that I mentioned, we'll link to a little bit about the genesis story, the background behind Back in Shape, behind how it all developed, behind us and our experience. But suffice to say, we had a lot of success to the point where it was recognized in quite a significant manner, unfortunately, just before the pandemic, but that's another story. And ultimately, the program itself, the Back in Shape program, since then has gone on to help tens of thousands more members as well in some capacity, whether it's this part of the phases, that part of the information, etc. It's helped tons and tons of people over our time. And that experience in the formative years in clinic has formulated or developed the ethos that we talk about and that we're going to be talking about today. And I think I'll close this out by just talking about the program's helped so many different people at this point, but more importantly, it started to get more and more in the way of surgeons, GPs, other osteopaths, chiropractors, etc., referring to the program, referring their patients to the program to get the rehabilitation they need. And some of those specialists themselves are actually doing the program. And I refer to Annie's story here, again, link just on the side here, and we'll send a link to this afterwards. But Annie was a GP. She actually retired whilst being with us. I just reached that time in life when she retired. But her story is so very interesting, of a GP who's a qualified individual, who's got her own issues with her back, sciatica, etc., stopping her doing the things that she wants to do, struggling with the standard guidance that she's having to give patients, looking for something else, and eventually comes across the program. What we say makes sense so much that she really goes in for it and has successes. And earlier this year, she's run a marathon. Back end of last year, she did a very, very long hike across the northern part of Spain. Tremendous achievements, turning this around in an absolutely monumental way. But I say that to say that some of our members are medically trained individuals, paramedics, nurses, GPs like Annie. They're other medical specialists. Maybe it's, for example, one member in particular, a gastroenterologist. These people are a little bit more clued up than the average person, and they are more critical on us, more challenging to us with their questions. Hey, what about this? What about that? Because they've got the knowledge to ask us those pressing and difficult questions. And the point is that there's a lot of theory behind this. There's a lot of education, there's a lot of explanation that goes behind the principles that we're talking about. It's not just made up and popped up out of thin air. There's a lot to it, and it's been tried, tested, questioned, and challenged by medical professionals, not just the average person. So that's a very important point to labour, because it has been battle tested, is my real point there. So that brings me to this next part, which kind of feeds on really nicely, and that is the main challenge and why things haven't worked. Because ultimately, you guys are obviously thinking, I've tried other professionals, they said they were good, why are you better? And that's really the important thing. And fundamentally, it comes down to so much of what you've been doing up until this point has been doing the wrong exercises. And the cardinal sin here is this focus on flexing the spine, dealing with the tightness that might have developed in the back, and doing movements that involve spinal flexion. Now, I'm just going to take a moment here. Sorry. By the way, make sure you've got some water to keep yourself hydrated as we're going through this. Take a moment to go through spinal flexion and why knee hugs, child's pose, cat-cow, all of those sorts of rounding exercises are so problematic. When we injure the lower back, it's a compression injury, and it's a compression and stretch through the ligaments. So we have a compression through the front part of the discs, and it's a stretching through these structures on the back here. Our lifestyles with sitting, etc., don't help this, but fundamentally that is what is happening. And these sorts of stretches replicate the very stresses that have led to these problems. Think about your own back injury, for example. Often they're set off by leaning forwards. It's putting the socks on, it's putting the child seat in the car, it's doing the shopping, etc. It's very rarely going off back in this direction, although that can happen too when there's instability in the back and we shear some of the joints. But we often get taught to do these knee hugging, back flattening exercises because they do this. What do they do here? Well, when we have any injury in the lower back, we get a buildup of inflammation in and around these little spaces where the nerves come out. And that inflammation is building up in a confined space. And unlike other areas, wrist injuries, elbow injuries, shoulder injuries, knee, etc., although there's some nuance in the shoulder where this kind of does apply, we have a confined space here that's bounded by bony margins. So these stretches, when there's a buildup of pressure in the back here, the pressure is not the problem. The pressure is a problem, but the pressure is a reaction to the problem. Inflammation is building up in this area. So you feel this tension, this pressure building in the back. So you get told to do these flexion-based exercises because they feel nice when you're doing them. And you'll do them with your practitioner, be them an osteopath, physical therapist, physiotherapist, if you're in the US or the UK. your chiropractor, etc. And it'll feel nice when you're doing that flexion. It stretches all these muscles, but fundamentally it is repeating the very injury that's taken place in the first instance and creating a problem. We don't, in that first instance, need to be doing spinal flexion, flattening of the lumbar spine. And the very reason that these are recommended is really, others just don't know. You have to understand, many practitioners do not have that experience. And if I draw back to what I mentioned earlier, the 10,000 plus patients that we've seen over the years, in clinical practice this is, all of those people were spine patients, more or less, maybe 5, 10, 15 were not, but all of those were spine patients. And certainly in our clinic, the Mayfair Clinic, 90 to 95% of those patients had back pain, and the others would be neck and back issues or neck only issues. Every single patient had that physical exam. So you're looking at the patient, you're understanding, because we're taught that at university. You're taught that through your education, to look at the patient, understand their balances, etc. But they also had spinal imaging. And this is really the pivotal difference between what we talk about, why it's informed better than the average practitioner. Because it's in the process of doing these physical examinations and realizing I don't really have a very good understanding. We, as practitioners, be us an osteopath, a chiro, physio, etc., do not have the best ability to actually ascertain what is going on within the spine. You've probably heard, or maybe even at your own appointments, oh, I can feel that the L4-5 isn't moving very well, or I can feel that the L5 vertebra is in the wrong place, or the disc is sticking out. The reality is that is quite frankly a load of rubbish, and it's said to try and be reassuring for you, but you just don't know. You cannot possibly feel those things, yet they're used as kind of throwaway statements to add to credibility of the examination process, but it's wrong. And unless you've had that humbling experience of seeing thousands upon thousands of people's presentations physically and their spine, you don't have that appreciation for what you don't know from the surface. And that leads you to making recommendations of, oh, well, it's just a tight muscle and we just need to alleviate the pressure, so we just need to flex and round out the lumbar spine, because they don't have an appreciation of the structure. And this gets me into sort of the 4 educational errors that most practitioners that are recommending these sorts of exercises have, and why you've unfortunately been caught out by that. And it's not their fault. It's not said through malicious intent. They just don't know, and that's very important. I don't want to make it out to be some sort of grand conspiracy. It's just that they don't have that experience, unfortunately. And quite frankly, this starts back at university now. For your understanding, osteopaths and chiropractors tend to have a lot more in the way of spinal education than the standard physiotherapists in their degree. The degrees are longer, they're more in detail, etc. But you're also not taught about the spinal alignment. You're taught that the spine has a number of different vertebrae. They have a body, they have the back part of the vertebrae, they have the spinous process, they have this process, etc., etc., etc. The muscles attach on here and here and here. But you never get taught how they should be aligned. It's like being taught about a chair. We have a leg, we have a leg, we have a leg, we have a leg, and we have a stand. And those are the parts. And this attaches in here and this attaches in here. But you never get taught what the actual structure should be like in a load-bearing individual. And then how that structure bears load. And then how that structure can bear load, and how different positions stress the spine in different ways. That's just never taught. That's something that's very much postgraduate, and that's something that we found very interesting, and that's kind of the route that I specifically have gone down in the early postgraduate years, and that's what's been forming the foundation, that deeper understanding of what's going on in the spine. Secondarily to that, if you haven't had the experience with imaging, as I mentioned earlier, that we'd had, you don't have that understanding, and you rely too much on examination. Many of you will have been told, I've got anterior pelvic tilt here, your back's too flat, or your back's too arched. You just don't know. So you make those sorts of statements, which patients like yourself take on board. Oh, I've got too much curve, I should flatten my lower back. But the reality is that's extremely inaccurate, and you'd only know that if you had imaging exposure regularly and you knew how unlikely your physical examination is to be accurate. And the real problem is that the recommendations to flatten the lumbar spine actually work. And the problem is they often work and you didn't need them, so they make you go from flat to flatter. And that's a real problem for your long-term longevity when it comes to the lumbar spine. So if you instead of having a nice smooth curve, it should be 40 degrees, etc., and having a nice smooth curve through here, if you had a flatter spine and they've misguidedly told you that you have too much curve, and then you start flattening things back even more with pelvic tucks, now you all of a sudden have a straight spine, and that's a serious problem. It's very inefficient. It creates destabilization of the sacroiliac joints, etc., etc., etc. And then we wonder why things aren't working, because they rely too much, you've been the victim of relying too much on a physical examination and conclusions drawn that just simply can't be made accurately, and then actions taken on that faulty information. And fundamentally, point number 3 is that most practitioners, osteopaths and chiropractors in particular, osteopaths and physiotherapists in particular will be generalists. They will work in a generalist community practice. They will not be specializing in back pain. They will work and see shoulders and see ankles and wrists, etc. We didn't see that. We just saw spine, which is why our guidance and our experience is so very focused. And then finally, that results in a very much a muscle and movement based approach that you will typically have seen, which is why you've had the recommendations of things like knee hugs and child's pose, because it's stiffness, it's a muscle. We need to stretch the muscle, we need to move the spine more to allow it to heal. And that, with the spine, is an inappropriate way of doing things. It just doesn't work. Instead of that, we want to work from a spine stability first approach. And with that, we can start getting into some of the principles. So if you haven't already, make sure you get up and walk around, because we don't want you sat down for too long. Now, we'll go through these pretty quick, okay? Because then we're going to get into the practical side of things. So ultimately, these are principles for a healthy back, and they need to be observed if you're going to have successful recovery. If they're not observed, then you're going to find that you might get some short-term results, some short-term relief, but then things come back. And these are just drawn out of the Back in Shape program in its entirety and put down here to 4 real principles, if you will, to really help you move forwards. And before we get into those 4 principles, understand that you have an injury in your lower back. Now, there are some comments about the perception of that injury, the severity of that injury, particularly in chronic cases, becoming a little bit muddied, talking about sensitization and the perception of signals being inappropriate to the actual severity of the injury, and that's a layer of complexity that is maybe best addressed another time. But the simple fact remains, in spite of that, there is an injury in the lower back and an injury that needs to resolve, and the injury is going to be to the joint structures. When we injure our joints, our knee joint, our elbow joint, any of the other joints not in the spine, it's the joint that's injured, it's the capsule, it's the ligament, etc. It's the things that maintain that joint integrity, and the lower back is no different. Yet the lower back is the only thing, because of the things that we've mentioned in the previous section, the lower back is the only area where we say, oh, it's just a muscle, it's just a muscle. It's not just a muscle. You've injured the things that maintain the integrity of this system. The spine is just a stack of bones stacked on top of one another. Why do they not fall apart? Well, this one doesn't because it's got a metal rod going through it. Yours doesn't because you have a complex web of ligaments and joint capsules that run through this entire thing, blending with the discs, blending with the facet joints on the back, blending with the sacroiliac joints, etc., to provide a consistent tension through the whole thing. So when we move, when force goes through the spine in any sort of force, twisting, bending, etc., it pulls all of them equally. As soon as we have an injury, now we have this continuous sheet of smooth movement that is disrupted by a section. Let's just say here, what is that? The 3-4, L3-4, that now all of a sudden has a little bit more wobbliness to it. And that's that instability that needs to be protected from in the first term. And that is why principle number 1 is talking about spine stability. We work from a principle of stabilizing your spine from the get-go all the way through our rehabilitation. Stage 1, stage 2, stage 3, which we'll talk about here, or if you're in the Back in Shape program, we're talking about phase 1, 2, 3, and 4. And you're going to be focusing on that ability to stabilize the spine. Know that the spine failed because you didn't maintain stability. As you bent forwards, one of those particular segments, which was perhaps vulnerable for many reasons we could get into another time, profuse sitting, etc., certain activities, lifting, etc., with bad form, has worn away at the strength and integrity of that particular segment, repetitive strain sort of injury, and then it's just gone. And it's that one that has moved more than it should do. So what we must do in the short term is start to learn to stabilize our spine again, make spinal movement steady, and so that hips can move themselves. And that brings me to point number 2, which is hip strength and then flexibility. Too many of you will have been working on flexibility exercises, on stretches, a classic hamstring stretch, where we just round over. We don't distinguish lumbar spine movement, which is going to aggravate the lower back and aggravate the problem, with a stretch and a need to maintain good, healthy hip movement. But strength comes first. The people that struggle the most are those often that are the most flexible, those with hypermobility, because they have too much flexibility, they have too much mobility, everything's so wobbly, and they're not able to provide stability. So we work on strength first, and then we build in flexibility as we move forwards. And we need to have good flexibility of the hips, because going back to your diagnosis, Remember where that list of diagnoses we have, and you've got your own. To the degree you're more on the serious end of that diagnosis, maybe you've had a spinal surgery, maybe you had some fusion, we've got some bolts in the spine, maybe we've had a spondylolisthesis like Janet had, maybe we've got some other sort of condition like that, maybe there's a lot of degenerative change, some stenosis present from bony spurs, etc. You need to make sure that your hips are more flexible, more mobile, and stronger first than the average person, because you will get away with movement translating from the hips into the lumbar spine less, particularly during the recovery phase of your rehabilitation. Once everything's healed up and you're good and you're nice and you're ready to go, then we can start talking about different things. But that's for another presentation, another time in the future. Right now, your focus needs to be on that hip strength and then flexibility alongside the spinal stability. And then points 3 and 4 are a little bit more about how we approach and apply those things to the real world. Point 3 is that the movements that you're doing in your rehab are relevant to the movements of real life. And we will touch on this in stage number 2 in particular, because it is so very important that you appreciate that. And especially with the context of pain. And point number 4 is we want to go conservative. We're not going to get you start throwing around kettlebells, throwing around weights, etc. in the early days. You must go from technique first and safety first and utilize what's called regressions, which is where these particular movements will be real life movements. You're already going to be doing them, but we might make them a little bit easier for you because you're not competent enough to do the movement properly. And if we take a brief example now of a squat, if you are not competent enough to do a squat beyond a small amount of range of motion, a slight bend in the knees perhaps, before the pain kicks in, then what is happening every time you get down on a chair? You sit on a chair every day. That is a major factor that's maintaining your lower back pain because you're not doing it properly. So we need to learn to do that squat with a very reduced range of motion, a pain-free range of motion, or more or less pain-free. And if you're in pain every single hour of every single day, then it's just not exacerbating the pain. So figuring out the range, and then we move on from there. And I think that's a really important point to not avoid. Some of you guys are going to be in pain. That's why you're here. It wasn't a lack of pain that motivated you to go and watch a masterclass on back health. It was the pain. And some of you will also be thinking, hey, but I'm in too much pain to do exercises. I can't do exercises right now. And the reality is you're already, because the things that we're teaching are real life movements, you're already doing these movements. You're just doing them without any thought, without any care, and ultimately without any benefit from doing them. Doing them in the context of these exercises will allow you to start to learn to do them. So from day one, you're more thoughtful and you're gradually starting to learn. Granted, you're not going to master them immediately at the perfect range of motion with the perfect depth and the perfect range, perfect weights, but you will start to get better at them, which means that every single day from today on, you will not be aggravating yourself as much. And to the degree you get better at these, you will be aggravating yourself less. That allows your healing process to start to gather some momentum, and then we can go on from there. Now, one final thing on that topic is, remember, you have an injury. And the injury, when it comes to lower back injuries from down here in the lumbar spine, so particularly L4, L5, and L5S1 segments, those nerves go out to the glutes, they go out to the hamstrings, go out to the calves. When we have an injury down there, it is extremely common in nearly all cases. You're going to have a degree of muscle dysfunction, muscle tightness, etc. in the glutes, in the hamstrings, and in the back muscles as well. Particularly with the tightness of the hamstrings and the glutes, that is not helpful. Why? Because it means that your hips don't move as freely, so your lower back is going to have to get involved. So when you bend down to sit down, your back moves into that flex position, creates an aggravation, redisturbs an injury, and your back pain gets flared up again. You disrupt the healing process. And just like that surface of your skin, if you keep picking the scab, it doesn't heal as nicely. So we have to acknowledge that we have this loop while the injury is active, coming from the segment of the spine out to the muscles telling them to tighten up. This is one of the main reasons why just doing this mindless stretching over and over again does not help unless you have it part of a goal, which we're going to get onto in stage 1 in a second. You do your stretch. Stretching works, it actually releases the muscles, especially some stretches like PNF, etc. They get instant changes in flexibility, and that relieves your back pain. Then you go and reach for the kettle, and because you haven't worked on stability, all of a sudden you tweak that back, it flares it back up again, the signals go straight back down to the hamstring, tightens back up again. You've got zero results, nothing to prove, nothing to prove for your work, and no cumulative benefit. So you go round on a little hamster wheel, and that's what we want to avoid. And that's why, with reference to point number 2, of hip strength first, then flexibility, that's why we work on strength, because strength and technical improvement gives you the long-lasting benefits And then flexibility can actually be more effective later on once you've got that healing process really underway and you're not aggravating it with silly little things every single day like so many of you will be. So stage one, and this is where we're going to start getting practical. So I'm going to pop up in a moment and start demonstrating some things for you guys. So the important thing here is that stage one is not rehabilitation. Stage one is relief. And there's an important distinction which I'll talk about in a moment. You're going to spend a day or so to get these right technically, and hopefully you're going to make some notes as we're going through this because it is important that you do these technically well. I wouldn't be surprised if you can't do these right first time, and that would be a good thing if they aggravate you in some way, shape or form, because it shows that you've got something to learn, something to get better at. Very important. You will do these a couple of times a day as a means of providing relief, and I will explain relief in one moment. And you will also blend them with, so do them in addition to, the stuff that we're talking about in stages 2 and stages 3. These kind of are part of a back health and back hygiene routine, if you will. It's what we call our phase 1 routine that you can do for the long term to keep your back healthy, okay? I want you to draw on that distinction between a relieving of your spine and relieving of your pain. Too much of the big mistake that we discussed earlier is about relieving your pain. You have that inflammation that's built up in and around the spinal spaces, and that's causing you discomfort. So you flex forwards to relieve the pain. That creates a problem. It relieves the pain, but it makes the problem worse because you're pulling all those ligaments apart again, you're compressing down on the disc, you're driving the nucleus back, you're destabilizing the segment and preventing it from tightening back up again appropriately. And that's not muscles, that's the ligaments tightening back up and the healing process taking place. You can very easily see this on the surface of your skin as two sides of a wound start to drive each other back together again. If you're there constantly pulling them apart, it's not helpful. Although it relieves your pain immediately, perhaps, as it does for many, it will come back sooner and sooner. And to the degree you continue doing this, you're going to continue to disrupt the healing process and create more and more scar tissue. So it is not a smart move. Here, we are talking about relieving your spine, relieving the strain on your spine. Healing doesn't take place overnight. None of you will expect to cut your arm, wake up in the morning and it be completely fresh skin again. It takes time. The tissues in your back take longer, and they only start properly when you stop making them worse, when you stop aggravating them, which is why we covered the mistake first rather than these helpful points next. So the knee hugs are aggravating it. These things are providing support, relief, because at the end of the day, you're still living in the real world. You're still doing things on a daily basis. So that brings me to exercise number one, which is going to be bracing your core set without spinal movement. And this just involves using the deep set of muscles around your midsection. You can do it on the bed or on the floor. Those of you that are a bit more uncomfortable and a bit more pain, you can do it on the bed. We don't want you getting on the floor if getting on the floor is going to be a challenging task and involve you moving all over the place. You know, we're coming down, we're rounding our back like this and, oh, I'm in pain, I'm in pain, I'm in pain. That's just not worth it. It's not worth doing it on the floor. So you will do it on the bed instead, okay? And just to demonstrate, we've got these muscles that run around here. They run from the rib cage on the top, and they run all the way around and they form this nice little cylinder, like a corset around your spine. Many of you will have had the erroneous teachings when you're doing these in your yoga classes, in your Pilates classes, or maybe by your practitioners, whoever they be. And when I say practitioners, I'm referring to your physio, your osteopath, your chiropractor, whoever, your yoga instructor, your physical therapist. Many of you will be instructed when you engage the core, if you move this back a little bit, to pelvic tuck and flatten the lower back to the ground. This is incorrect. That flattening movement is not suitable for spinal strength, and this is what we talk about building from the ground up. You are lying on your back with a neutral spine, not flattening anything, and engaging the core. These muscles provide the stability, and we can do this with a nice breath. So if you pop yourself on the floor or on the bed, or just make some notes as I'm going through this now, and we can do 10 reps of this. It's a very, very simple one that every single one of you, bar no one, can do. We're going to lie ourselves down, take your time as you get down there. And I'll just try and sort of tuck my t-shirt in so you can see that there's my bum's touching the floor, my back has a little arch in it, which is normal. I'm not forcing the arch, I'm just led here, and my middle back is touching the floor. And then we can over-exaggerate by breathing in deeply. We imagine our diaphragm flattening down, and the tummy comes up, and then as we breathe out, everything comes in tight. Okay, all the way around. You should probably feel in this sort of line here, just to the about an inch or two to the side of your belly button. If you're doing this correctly, you should feel some core engagement, maybe even some cramping there as you draw everything in nice and tight. Note, this is very important, that I did not do this So many of you will do that sort of movement. And I've just flattened my lumbar spine and ruined the very principle that I'm trying to work on. Instead, we keep the spine nice and neutral. Breathe in and out. I always say, put your hands on your waist, hold it for 2 or 3 seconds so you can feel the contraction, and then repeat again. Breathe in and out. Hold it nice and tight. And what we're looking to do here is just provide this ability to control the spine. Now we're hooking it with the breath, so we'll do it again. So we'll breathe in, the tummy will rise, and breathe out. And the tummy will fall, and everything contract in all directions. Now, some of you will have been instructed to breathe out, to strain, etc. These are incorrect movements. Doing the straining can increase intradiscal pressure and create discomfort. What we're looking to do here instead is teach you the cognitive control over this area. Many of you who, and I'll pop back down there in a second, many of you guys who've had maybe, well, I'm talking about ladies here specifically, if you've had pregnancy, if you've had C-sections, had children, you've probably lost a bit of control over that particular section. And many of you will kind of be a bit confused when I talk about breathing. When I say breathe in, you're going to breathe in like so, as opposed to breathe in and the tummy come out. Your breathing is incorrect in that manner, especially if we're stressed. We have that habit of upper rib breathing, and we breathe in like this. Our rib cage is coming up, and we're sucking our tummy in as we breathe in. When in actual fact, we're also learning correct breathing here as well. So breathing in is, and then breathing out is, because our diaphragm is pressing down, pushing our abdominal contents out the way, and then it's pulling back in and up, and our core is squeezing to squeeze the air, like we were squeezing a bottle to squeeze the air out the top. That's the premise behind this particular exercise, the core engagement. The reason you're doing the core engagement this way is because it follows that principle that we mentioned earlier. It allows for spine stability. It does not move your spine. And this is so very important when we get to some of the later exercises. Because if you are reliant on doing a pelvic tuck in order to engage your core, if that's how you've learned, you will have to do a pelvic tuck when you stand up. And when you do a pelvic tuck standing up, we flatten the lumbar spine, pre-stress our discs, we stretch through the ligaments on the back here, and that one that's injured is going to move more. It's going to move more because it hasn't healed up properly and its tension has not been restored. This takes a long period of time, and why stage 3 is so important for the long term. It takes a long period of time for it to build back up. This is why those sorts of movements are so terrible in the early days. Things like the pelvic tucks and this and that way of learning to engage the core. We must work on spine stability, engaging our core independently of any spinal movement, so that we can then, when we get onto some of these later exercises, we can hook that control into an upright exercise and keep everything in the best, most optimal position for the spine. That is a principle that is going to be true for the entirety of what we're talking about here and for your long-term success. And not only does it work on the strengthening-based exercises, but that brings me to the hip work now as well. Because too many of you, when you've been doing your stretching, you've done your classic hamstring stretch. I'll just use this chair for example, and we're going down and we're touching our toes. Straight leg, touch the toes. What on earth is happening to my lower back? I'm rounding it terribly through here, violating the very principles that we've just discussed. Is a hamstring stretch going to be helpful? Yes, it's temporary in its effect, especially this early on in stage 1, but it is helpful nonetheless, because if we release the hamstring a little bit more, our hips are a little bit more free to move with a neutral spine, and we're going to find it decreases the strain on the injury. Okay, so that's very important. So when we're doing our hamstring stretch, we're going to go through 2. We're going to go through a hamstring stretch and we're going to go through a hip flexor stretch. Why? Because the hamstrings pull our bum under and flatten our lumbar spine, and the hip flexors pull our bum into that direction and arch the lumbar spine and pull us forwards and can create their own issues on the opposing side. We want to be balanced. Again, going back to what I mentioned earlier about the experience, we don't know if you've got anterior pelvic tilt. You don't know if you've got anterior pelvic tilt or posterior pelvic tilt or any pelvic tilt for that matter. All we know is we can maintain your spine, because chances are you have a normal spine. Unless you, and if we hypothesize that we don't, we need to get that checked objectively, not by someone just feeling and touching and looking, on a load-bearing image if you want to get that. This works irrespective of having that information, because we just maintain neutral. So we're going to work on the hamstrings first, and you can do this seated or standing. We'll do it seated for the sake of this one. We engage our core like we just did in that core engagement exercise, pop the leg out in front, we have a slight bend in the knee, and then we simply pivot forwards. All I'm doing here with this particular movement is sticking my bum out. I'm sticking my bum out as my spine moves. There is no spinal bending. The only thing that's bending here is the hip. And that's the way we do a successful hamstring stretch. A slight bend in the knee so we feel it in the back of the meat of the thigh, not in the back of the knee capsule, otherwise we're going to get knee problems. And then we just stick our bum back. The variation of this, and we hold that there, and we hold that there for 30 seconds. And we try and do this with the other practices that we're talking about. So the last exercise, you might be doing 10 repetitions, and you're going to do that as part of a little routine 2 or 3 times a day. We're going to do this, holding it for 30 seconds, twice on each leg. We could do a standing variation, which is exactly the same principle. We're just using an elevated platform. Maybe we're holding onto the wall for balance, leg up, and stick our bum back, nice and engaged core, because we've learned how to do that in step 1. Exercise 1 came first for a reason. We engage our core, we stick our bum back, and boom, we've got the hamstring stretch already in here. Some of you will go further than me. Some of you won't be able to lift your leg up onto the chair there. You'll have to do it on the bottom step. You'll be more stiff than me. It doesn't really matter. You do what's right for you, but we don't violate the principle of spinal stability when we're doing this particular stretch. So then we get onto the hip flexor stretch. I would always suggest if you're doing this, do it near the bed, do it near the sofa, do it near a chair, so you have some sort of support. Those of you that have knee replacements, that have sore knees, arthritic knees, etc., use a cushion or a mat underneath your knee so you've got that support as well, and that'll make life an awful lot easier. Like with the hamstring stretch, where the classic mistake is the person rounds their back, the classic mistake with the hip flexor stretch is that as we push forwards, we arch our backwards like so. And know that as you move forwards, we referred to your pain earlier, the pain you might be in, the flare-ups that you might have. Any flare-ups that you get, bar none, are due to movements not being controlled in the lumbar spine and creeping in. So this is where people say, hey, well, I've tried the hamstring stretch and it hurt my back. Why? Because you didn't stabilize your lumbar spine. I tried the hip flexor stretch like so, supported and everything, but it hurt my lower back and I got radiations down the back of my leg into my foot, like my sciatica normally goes off. Why is that? Because you arched your lower back. When you arched your lower back, the injured segment perhaps sheared a little bit, the holes where the nerves come out got smaller and therefore pinched a little bit on that nerve and aggravated the symptoms. If you have done exercise 1 correctly and learned how to do that, which can take you a couple of days for some people in clinic who really struggled, particularly ladies that had C-sections, it really did take a little while for you to learn, for them to learn how to engage that core and stabilize the spine. So don't be alarmed if it takes you a little bit of time to learn this. You must practice and practice and practice. And with that first exercise, the core engagement, there's no time there's no limit on how often you can practice that. You can practice it while the kettle's boiling, while you're sat down, while you're standing, while you're lying down. However, just make sure your spine is in a neutral position and you're engaging everything nice and tightly. That way, when we come to do something like a hip flexor stretch like so, holding it for 30 seconds, our spine is nice and neutral. We've got a bit of support here to hold ourselves and we're not moving the lower back. We are affecting the hips only. So that's the first 2, the core engagement, and then we've got the 2 hip stretches. Now comes the all-important decompression. The towel decompression. If this is one stretch you could do for life, we did a whole podcast episode on this. This is the one that you need to do for your health, because the average adult spends 9.5 hours a day sitting. That is a tremendous amount of flexion that will be going through the lumbar spine while you're sat in your various chairs commuting. And fundamentally, that statistic, it was first saw it by the British Heart Foundation, is fundamentally an explainer for why, or a very, very strong justification for why that flexion is just not required. That rounding of the back is just not required. You spend too much of your day already doing it, and that is a maintaining factor in your back pain itself. So what are we doing with this towel? We are opposing that. We're really doing a couple of key things. The towel is decompressing the lumbar spine, so it's taking pressure off the discs safely, because when you're lying over it, we have a gentle stretch coming through the spine. There's a gentle pull, decompression, if you will. Those of you that have had spinal decompression, not the surgical variation, but the mechanical variation, traction, IDD therapy, this is essentially what's happening, but it's a much more accessible. Every single one of you has a towel at home. You can lie on the floor or lie on the bed to start with to do this. It's putting a gentle decompression through the spine, taking pressure off the discs. Everyone with a lower back issue will have some degree of disc involvement. You just will. It's impossible. We segment out, for example, even with Janet's case, we talk about a spondylolisthesis, which is a shearing. That means the facets are gone. That means the discs are damaged. That means there's going to be bony spurs. There's going to be ligamentous issues as well. Even with a facet injury, you're going to have problems in the disc at the same time. They may not be as noticeable, they may not be as severe, but these are spinal segments. The whole thing works as a segment, front with the disc, back with the facet, and all the ligaments to boot. So we have to have something, thankfully, that can, thankfully we do with the towel, that can address all of those. So number one is taking pressure off the discs. Because it's got a gentle stretch through it, it's not like the Cobra, which many people think it is like, which is a compressive movement that compresses the back part of your spine. This is very different. It's got a gentle stretch, so it decompresses the facets as well. It holds the spine in its neutral position, a position which probably most of your day it is not in. It also then takes pressure off the ligaments on the back. Those same ligaments I said are being pulled apart when you do the flexion. It's doing the exact opposite and holding them together. Kind of like we could think perhaps the purpose of stitches. When you have a wound that's pulled apart, you use stitches to pull it back together to help that reunification process. And it's the same thing here. You're holding your body in a normal, neutral position or closer to it. We also have the effect of taking the muscles off strain. I haven't gone into this in a great amount of detail, but we do in other episodes, for example, of the podcast. But fundamentally, a lot of you, that tension that you feel is that the muscles are being pulled apart. You want to stretch it, which is why you're given the knee hugs, etc. But actually, taking pressure off the muscles is just the same. For example, if you are holding a weight out, for example, this spine at arm's length, my muscles are on tension. They are in an inefficient position, that bad posture. I can either try and stretch them out to alleviate it, or I can just drop the weight, take the pressure off the muscle, and now all of a sudden it can relax a little bit. And that's what this towel is doing. So it's a very important way of you getting on and off the towel, which I want to cover, because so many, and this is cue for that magic principle we mentioned later on, so many will do this incorrectly. So we have our towel rolled up, you lie yourself on your back to start with, okay? The safest way of doing this is to go onto your side first, and then roll onto your back, without twisting the spine again. So we do that. Then we engage our core nice and tight, and we just lift our bum up and we slide this in to that lower lumbar spine area and lower ourselves over here. Now, some of you will find this difficult. To the degree you find this difficult, it's very likely that you have more degenerative change in your lower back and a more chronic problem or a more acute problem. And that's normal for many people to struggle with this to start with. It gets easier because it's putting you back to a better position for the first time, often in a very, very long time. And if you're one of those people that spends that 9.5 hours or more a day sitting, it's opposing so much of movement in one direction to try and bring you back to a healthier movement. It's like if you were eating sugar all day, you need to brush your teeth a little bit more to get rid of some of that rubbish. And this is trying to oppose that rubbish that you're eating all day in the case of the toothbrush example. This is trying to oppose so much of what you're doing every day. And we'll get to more on that a little bit later. But that's why it can be a bit uncomfortable. When you finish, you brace your spine using that core engagement that we discussed, the very first exercise. You hold everything nice and fused, and you just tip yourself off to the side. And then you give yourself a few moments before you get up. Maybe you rest here like so, and then we pop ourselves up nice and slowly. Don't rush afterwards. Very, very important. You can do this for 30 seconds, 2 minutes, 5 minutes, no longer than that, but you can do it periodically through the day. Then that brings us to number 4. Number 4 is nice and simple. It's using ice, not heat. You'll read a lot nowadays, especially in the sporting space, that inflammation is a good process. It is. It's necessary for healing. But we want to encourage inflammation. Not excessively, but we want to encourage inflammation because it's helping remove waste products from an area, and it's helping bring new resources to an area to help with the healing process. And that is true. But the problem is that most of that is talking about peripheral injuries to the wrist, ankle, knees, etc. In the lower back, we have confined spaces, as you can see, where these nerves come out. So many of you will probably have at some point had an MRI scan, maybe, or you've had some sort of imaging, and they say, hey, you've got a disc bulge here, but it's not pressing on the nerve. Why do you have the nerve pain then? Why do you have the pain down there? And a lot of that is because the inflammation builds up to levels where it is congested in that area where that nerve is coming out, and that is what is causing the pain. The disc is bulging because it's injured, and that attracts inflammation. And It's kind of like having a lift that's supposed to take 10 people, and all of a sudden you start sticking in 12, 13, 14 people. Someone's going to start making a noise at some point sooner or later. And that's what's happening when we have cases of stenosis, be they from discs, be they from other injuries, be they from facet arthropathy, be them from some of the ligaments undergoing a bit of hypertrophy, be them, like in Janet's case, a case of spondylolisthesis, changing the shape and size of this little hole because the vertebra's shifted forwards. Any number of different things. But the ice helps us control excess inflammation, because in the lower back, we don't have a very good mechanism for this. And this is why quite often, because of the stillness when we're sleeping at night, people wake up with back pain in the middle of the night, and why people wake up first thing, back pain can often be an awful lot worse as well, because inflammation builds up in those confined spaces. So unlike other things, we want other injuries where they might talk about actually using heat or other procedures. When it comes to the lower back, you want that ice. And that's why we kicked off today telling you guys to use a little bit of ice on your spine for 3 to 5 minutes periodically through this presentation. And hopefully there's another cue for you to get up and just have a little move around to make sure your back is not getting too congested. So the final thing with this is just to point out that this is a relieving activity. One of the big mistakes, again, another mistake that people make, is they do these sorts of relieving exercises thinking they are rehabilitation exercises. These are just going to help your back calm down, but they are not rebuilding the injured tissue. So if you have repeated episodes of this without ever doing rehabilitation, all that's happening is your symptoms may come, they get better, but you never rebuild the tissues. So you're weaker and weaker and weaker and weaker and weaker. And that's why episodes get worse and worse and worse with each passing episode. You must move on to rehabilitation, which is why I said at the very start of this stage 1 section, you spend a day or so getting to grips with these exercises. And you bring this routine with you into stage 2 and stage 3, but you must move to stage 2 and stage 3. So what is stage 2? Stage 2 is building from the ground up. So bear in mind that all of those patients, those 10,000 plus patients that we saw clinically, obviously we knew they were in the clinic, they weren't bedbound, okay? But the many tens of thousands of members that have joined us, so cumulatively over the years, very often when people started, we used to give them a nice little questionnaire, and they tell us, the conditioning, etc. And practically no one is bedbound, and chances are you're not too. So we know that you're already doing the movements that we're about to discuss in the real world. You're already doing them, so you don't need to be. And I know there's that concern, and this is going back to what we mentioned earlier about pain. Think, oh, I'm not ready for exercises, but you're already doing these, and I'm going to try my best to draw these out just to explain just how easy these exercises are, and if they do give you pain, when you're doing them in a focused manner, know that they are reminiscent of activities that you're doing on a daily basis every single day. Whether you're walking the dog, whether you're getting up in the morning, going to the bathroom, sitting down to watch TV, sitting down to try and relieve your back, standing up to relieve your back, moving around to relieve your back, you're always putting strain on the back. So you better spend some time learning to do these exercises correctly, because they are building the foundational protection mechanisms that allow healing in your lower back to start to take place and build a little bit of momentum. So what's the first exercise? Well, the principle here is that we start with you on the floor. We're going to be doing a modified dead bug here. And what we're doing is we're doing that core engagement that we started off before, but we don't need to do the breathing. Once you've got the engagement down, if I demonstrate, you should be able to control the core space yourself. You can turn it off, turn it back on again, turn it off, turn it back on again. I'm not tucking my spine at any point doing that. I'm just engaging and relaxing those muscles. You don't need to hold your breath, etc. But some of you, the reason we teach it with the breathing in the last section is because that's how some people need to do it, to learn it. Once you can start to feel it, you can start to get control over it, and you use it when you're doing these exercises to stabilize the spine. And the principle behind these dead bugs is that it's like life, but you're lying down, so it's super safe. You're just in bed. When you're in bed and you roll over to get out of bed, you do this, but with more strain because your whole body's moving. Here, we're just lying on the floor. We're engaging our core through here to hold the spine steady, and we're engaging the glute and leg muscles, hamstrings, and to a degree the hip flexors in certain parts of this, to move one leg out and one leg back in again. And what that does is that creates a myofascial pull through this side only, and that pulls on the lower back. And as the leg goes out, the back is going to want to arch, and you're going to control it. You're going to stop it from moving. And to the degree you do this successfully, you will not have pain. To the degree you fail to do this, you will get pain. If you get pain, it's because your spine moved one way or moved the other. And that's a cue to learn to do it correctly. Think about it. If we cannot, so people are concerned about doing this, which is why I mentioned this. Oh, well, can I do this? If we cannot lie on our back, like so, engaged with a neutral spine, if we cannot manage that without getting pain, we have a real problem. Because any activity you're doing on a daily basis, which I would argue you're probably already doing in spite of the pain, is both not giving you any results, is aggravating and worsening your symptoms, and it's not actually making you any better either, but you're doing it anyway. So even if this is difficult, learn how to do it correctly, because the only way you will learn control is by practicing control. And this is the safest way you could possibly do it. So the full dead bug exercise is we engage our core. We always say we have our hands on here so we can get that extra feedback, that extra sensor, like having an extra sensor on the dashboard. So we can feel that the core has engaged. We have our legs up, and then our leg goes out, and then it comes back in. If that's too difficult, our leg goes to here. If that's too difficult, our leg just goes a little bit. If that's still too difficult, we start like this, and we just bring one leg up, the other leg up, one leg down, the other leg down. Obviously with the head relaxed the whole time. I'm just checking like you guys can see me, okay? And if that is still too difficult, we engage, and we lift one leg, bring it back down, and we lift the other leg, and we bring it back down. And if your spine is moving on any of those exercises, then you're going to get some pain. And it's your job to work with the core to be able to develop from this one to this one, to doing half reps or quarter reps, to doing full reps. And know that as we're in that out position, we can get some good feedback if we're recording ourselves. If our spine comes up like so, our tummy, comes up like so, we've lost the engagement. Everything's gone wrong. So that's why you've got your hands on your stomach there to get that additional feedback. Because if you let go of that core engagement, when just the weight of your leg is challenging your core, what's happening when you're up and about and you're moving the kettle? Oh, I've got to pick the kettle up and put it over here. Or I've got to pick up the little one. My toddler wants to play with me on the floor. I'm going to have to go down there. Oh, I've got bad back pain, but I'll do it anyway because I can't say no to her. She's so cute. You're going to go and play with them. So if you're struggling with this, get it right. You've got to make time to do this. And I would argue to the degree you struggle with these and you find they're provoking, you need to spend more time, be more reflective, record what you're doing. It might be that you have to start doing it on the bed. As soon as you can, we do it on the floor because that's better, and progress that way. But that's the dead bugs. We're ideally looking at doing 10 reps of those. So 1, 2, 3, 4, up to 10, and building from there with numerous sets. So that's a very important skill off weight bearing. The next step, and remember, this is all about your spine maintaining stability. We did it in stage 1, your spine held its stability. In stage 2 now, we've held stability while you're lying down with the legs pulling you in different directions. Now we're going to put you upright. And we're going to start off with the squat movement, which is sitting in a chair. We know this from members because they upload into the group. And this week we happen to be doing squat challenge. So it's a little challenge to see what your squat's like versus sitting in a chair. But we know many, maybe even like yourself, when you do a squat, at some point during the squat, you're going to get pain. Okay? So you think, oh, I'm not ready for a squat. I get some pain. So as you're going down, oh, the pain comes in. What's happened? My back's rounded. I lost that core engagement. I'm a mile away from that chair. So what's happening when I sit on the toilet? What on earth is happening to my back? What's happening when I sit on the dining table? What is happening to my back? If I can only go this low before I get pain, I have a real problem. So understand that this might sound, oh, I'm not ready for squats, but you're already doing a squat every day. If you've been getting up when I've told you to, you've already done 2 or 3 squats while you've been watching this episode, but with none of the care and attention and diligence that we're doing now. So what we do with this is we get ourselves nice and square. There's knee training points. We don't want our knees going in and out, etc. That's very important. We maybe record ourselves and we just squat. We have a nice neutral spine. That core engagement that we discussed, we're looking straight ahead, and we just squat down as low as we can go. And we come back up. And if that's too deep and that starts to cause pain because your back moves or you wobble left and right, whatever the case may be, we just go to there. If that's all you're doing to start with, some members that we've had will start with just a little squat. Maybe they even need to hold onto the wall for a bit of support to start doing it. And they do it really slow and really controlled. But with time, you can do it so you can get down into a chair without the back rounding. And when you've got that point, you now are sitting down in chairs, providing you're applying it. You're sitting down in chairs every day, numerous times, in a safer way. You're not just parachuting down with a rounded back and boom, we hit the ground. So that's number one. Number two, we talk about number two when we're brushing our teeth, and that is the hip hinge. Every one of you are going to be doing this. And this again is a symmetrical one. So it's a little bit easier. We're just focusing on the spine failing in one way or the other. This is the most common way it fails, with a little bit of twisting to one side or the other, but we'll get to that in the last exercise. The hip hinge is used in your hamstring stretch. So you've already had a bit of practice doing this, but you haven't been quite aware of it. And hopefully, as you get better at the hip hinge here, your hamstring stretching will also improve as well, because you're being thoughtful and you're learning strength. Because what's happening now is your core is having to engage, and as we do the hip hinge, we slowly lower in this direction to brush our teeth. Now, you're going to go as far as you can on this movement. Some of you will be able to go further. Some of you won't be able to go this far. Some of you will find that, oh, the pain's hit in. Is that because you've gone too far, or is that because you've lost the engagement? And what you will find when you do this movement is tension develops in the back, and that is normal, but it puts people off. Why is that tension developing? That tension is developing in the lower back because our hamstrings, remember those hamstrings earlier, we said they pull them round? When you're doing your core engagement and you're setting yourself first, your lumbar muscles are engaged. Your core around here is engaged nice and tight. Everything is working with itself to provide stability and hold it all tight. As you go forwards, there will be a point at which your hamstring flexibility pulls on this ischial tuberosity, this bone here, and says no more. And at that point, the pull from here will be combated by the pull from here, and you will feel that tension. And at a certain point, you'll just feel you stop, you can't go any further, and something's got to give. Now, the failure that you will most likely run into is that instead of just stopping the movement, you'll just carry on rounding your back, and that's the mistake. Learning when that point is, that bite point, and holding and maintaining it will involve some tension in the lower back. Those muscles are going to be tense. This is why this is this far down on the list. It's engaging those muscles to provide support. So when we do our hip hinge movements, we're going to again look at 10 reps, and we're going to just simply get the movement right, going down and back up, going down and back up. And when you're doing these, you don't need to stand all the way back up to straight or anything like that, because as we stand up to straight, we disengage everything. We want to keep the muscles on while we're doing this to get the practice in. So we're kind of 5 degrees off being completely upright. We've got all our muscles engaged, our core's in, everything like that. We can even brace our back muscles as well through here to really engage everything. And then we slowly lower till we feel that bite point. Hamstrings stopping us, back muscles nice and tight. And that's where we're going to, and come up. And you will find that this improves your flexibility as well, but improves your flexibility with strength. And later on, we'll talk about, you grab a kettlebell in here, and now we go down again. Exactly the same thing, building on these principles, but to start with, you're not using any weights, of course. The final one is going to be the lunge. And you might think, oh gosh, I can't do a lunge. Are you going up and down steps? Do you have a step on the way into your house? Do you have a step on the way out of your house? Do you have stairs in your house? You're doing a lunge. The big problem with the lunge is that's taking what we did in the dead bug, and it's adding gravity, and eventually it's adding load, resistance bands, etc. And here, what we're having to do is, as we do the reverse lunge, we have a planted. And why are we doing a reverse lunge? Because a forward lunge involves additional skills. A forward lunge involves an impact, okay, I'm over exaggerating, and a deceleration, and then the lunge itself. Whereas with a backward lunge, we think of it as taking the front leg and slowly lowering ourselves into that position. Now we can go further than that, we can go all the way down to here, and then come back up. But to start with, maybe even supporting yourself on a wall, we engage our body and we just go into a gentle lunge. Okay, maybe holding onto the wall. So we'll be something like that, like so. What is this doing? I've now got gravity acting on me. So I'm training with gravity. I've got my core nice and strong, preventing spinal movement. I'm now using my legs more powerfully here. They're actually driving the entire movement with my whole body weight, and maybe in the future with a weight. And I'm having to engage those with my core. And because it's all coming in on one leg, I've got this wobbliness that can happen. And that if I don't control that wobbliness, I'm going to find that it aggravates because it changes the holes. It puts pressure on certain segments. So I have to engage myself really tightly as I go through that one lunge to hold my spine really steady as I'm doing this. And to the degree you manage to do that, and hold your spine steady, you won't get flare-ups. If, however, and this is a big warning for you doing this, you go too deep too far, unfortunately we see this from time to time, people just go straight in like so, everything's kind of wobbling all over the place, and then we go back up and we're going to have pain. So you back off and you really focus on planting that front leg and then on slowly lowering yourself back and then coming back up. And slowly we can go deeper and deeper with time. But that doesn't happen in a day or in a week. It happens over a period of time, depending on you and your personal levels of competence. And you're thinking about it all the while, holding that spine nice and steady. Now with all those 3 exercises or 4 exercises, a simple way forward is to start with 10 reps. Do 1, 2 or 3 sets, 3, 4, 5 sets to really build the intensity. And that brings us to the next point. And at this point, you would be doing those exercises that we just discussed with some of those ones from stage 1, because those stage 1 ones are relief ones, right? As you're doing these exercises, as you're living life, you have compression through your back. You're sat down watching this. Another cue to get up perhaps. And the muscles are going to get tight. The back's going to have load on it. So you're still going to be doing those stage 1 exercises, but you're also building resilience now. And that brings us in this stage 3 to guiding the healing process, building resilience and remodeling our tissues so they are stronger than ever before. And here we are building resilience using kettlebells in the later stages. First, often you find that bands are actually a better choice, using bands for those particular lifts that I've just discussed, the squat, the hip hinge and the lunge. Why? Because a band is most challenging at the top part of the repetition, and the band eases as we get to the weaker part of the repetition. It's harder on your muscles to come from here up to here than it is to go from here up to here. Mechanical advantage just dictates that it's easier at the top part of the range, and that's when the band is stronger. So the band actually weakens as you get to the bottom. So it's a little bit more appropriate for those of you getting into these movements. Later on, kettlebells, weights, etc. in the gym, those can work fine too, but you just have it a little bit easier if you're using the bands to start with. Why are we doing this? We're doing this to strengthen the muscles, because the muscles change faster. You learning the skill in stage 1 of engaging the core to provide control for that lumbar spine happens almost instantly. You'll be more aware of it. And with a little bit of time, you'll be a lot more aware of it and able to do it on a regular basis when you're doing all manner of activities. This decreases the frequency of aggravations happening on a daily basis with silly little tasks. That means that your healing can take place faster with less interruption. And as you're getting stronger, because those muscles change, you've got to have a good diet, support the recovery process, etc. But as you're getting stronger, that newfound muscle strength and the movement patterns that we've just been through will help protect you on a daily basis. So it starts to become a positive feedback loop. Whereas in the past, up until this point, perhaps, it's been a negative feedback loop. You're in pain, so you do less, so you become weaker, so you do even less, so you become weaker faster because you become more vulnerable, so you do even less. And then all of a sudden you feel like you can't even walk around the house without flaring your back up. This is the polar opposite of that. And that's when we do things correctly. Now, this brings me to a very, very important point that catches a lot of people out. They go, all right, Mike, I'll go through all of this, but I'm not going to lift again. And I say, are you going to go and live in space on the International Space Station, or are you going to live here on Earth? Because the reality is you're going to be living in an environment that has gravity on you and that you will do stuff. I mentioned earlier, the little one, if you've got a child or grandchildren, they're going to be picked up at some point. You'll need to do it. Maybe you're having to cross a busy road. Maybe they've fallen over and hurt themselves. You won't think about your back. You'll pick them up. And you should be able to. Our bodies are not that vulnerable. All of them. Janet included. Her back was like that in a very bad way. And she's able to do these things. You are too. We've got members that are doing all sorts of things with spinal fusions and other sorts of severe compromises to the lumbar spine. So you can do it too. And you can build strength and resilience. It just takes time. And you need to know that we talked about those muscles changing faster because they're protecting the process. But whilst that process is taking place and you're adding little bits of load carefully and steadily, and this is the kind of thing that we help guide our members with in the program, when to move up, etc. That load is helping guide the healing process. It's telling the discs, it's telling the ligaments in here, the cartilage, etc., the bone, to say, hey, you need to lay down a bit more tissue here, a bit more tissue here to deal with that compression that's going through there. We see this, the reverse of this happening as people become less and less active in their older years, and the fact that that can be reversed with the right sort of training. Having members that are in their 60s and 70s who are postmenopausal, who are increasing their bone mineral density done separately on separate tests outside of the Back in Shape program to verify these things, and going, hey, by the way, Mike, since I've been doing the program, my bone density has gone up, and being a woman, being postmenopausal, it should be going down. What's happening there? That's awesome. You know, the guys at the hospital were really pleasantly surprised. These sorts of things can happen if we train ourselves properly. So you will be using load to guide the resilience and the rebuilding and remodeling process of those tissues, but it happens very slowly. And that's why it's so important that you continue to do this, because often the pain will go away. You'll start to recover. You'll start to feel good again. You go back to those other things. The motivation to do the exercises starts to wane. You don't have the pain anymore. But you forget that the healing and remodeling process is continuing to try to occur. And without your careful stewardship, your careful guidance with these resistance exercises, you really will lose that guidance. And if you don't use it, you lose it. And if the impetus is not there to continue to build the strength of those deep tissues that maybe have some change in them, like the herniated discs, like the spondylolisthesis, like the other signs of degenerative change, if you're not guiding them, they'll do their own thing. And that won't invariably, that will not be a good thing for you. You must be consistent, even when the symptoms go, because that helps drive that regeneration process that's happening in the injured site and around the injured site. And that's what will build longevity. We also, at this stage, want to be working on our hip strength and flexibility more. Now, these two come in tandem, hand in hand or in tandem. You've got the strength which you will have been working on by adding resistance, but you will also find that as you are working with that resistance, you are trying to go lower and lower and lower. And that will in itself improve your flexibility, as well as dedicated flexibility work, and this doesn't need to be time consuming, by the way. So a nice example of this, something that we talk about with our members, is as you're moving up, you're going to move from one weight to the next, one band to the next, and the muscles are going to change pretty quickly. But the deeper structures, the joints that are trying to heal and remodel, they're a little bit slower to that load. So one of the nice things you can do is, say for the next 4 weeks, and I'm fast forwarding a bit for you, but giving you that guidance and worth making notes for a little bit later on. Say you say, okay, this week I'm going to put the weight up one. So you put the weight up on those lifts, those movements that we've just discussed. And then as the weight has gone up, you stick on that in that level for 4 weeks. And then instead of putting it up again when you're starting to feel it's too easy, instead of that, you go lower. You go deeper in the repetitions, because that will also challenge the muscles more. So then you spend another 3 or 4 weeks working on deeper repetitions of the same weight, challenging the muscles more, but not exposing your spine to the same rate of increase in load as you are the muscles. In a way, you're giving those muscles a bit of time to catch up to what's happening. Sorry, you're giving those deeper structures, the discs, the bones, the cartilage, the ligaments, a bit of time to catch up to the great adaptation that your muscles have been doing. Ultimately, that mix of strength and flexibility work works really, really well. And ultimately, this is the point really at which you're going to spend most of your time. The first 2 stages, obviously we've got the relief work and we've got the kind of the technical work getting you into this stuff. But this stage 3 is where you build this for the long term. And you must continue to do that for the long term to keep your body in a good condition. And we've had many members over the years who come through this, and patients alike, who actually find that they're stronger, they're more resilient than they have been in a very long time, and perhaps a very long time before they had their back pain. So that brings me to the back end of here, and we're talking about this magic principle that I alluded to earlier, and you will not succeed if you do not make this change. We need to acknowledge that we've been through a lot of stuff here, and hopefully that's been really, really helpful for you so far. You've got some practical tips, you made some notes, but know that when it comes to back pain, no matter what the diagnosis, no matter what's happened, no matter what treatment you've had, injections, surgeries, etc., you are the problem, but you are also the solution. Without you involved in this process, it cannot succeed. You can do your exercises, but realistically, you might be thinking, God, how much time am I spending doing exercises? Many of our members, when they get to that stage 4 level and they're really in a good position and they're maintaining these sorts of things, they may be spending an hour, 45 minutes, some of the workouts even just 30 minutes, 25 minutes to be exact, a day. And maybe they're doing that 4 or 5 days a week. It's not too onerous. Getting the ball rolling requires quite a bit of practice, because there's a lot you need to learn, a lot you need to do better, a lot you need to stop doing as well, so you save a bit of time there. But without then applying that, it's such a smaller part of the day that you're doing your exercises for. Without applying those lessons to the activities you're doing on a daily basis, you will not have success. You have to get out of the way of the problem. Ultimately, it's kind of like your skin, that skin cut again that we refer to. If you're constantly picking the scab and flicking it off, it's going to really struggle to heal. And your day is no different to that. If you're walking around the house, you're getting up, you're bending down like so, and this stuff, you go around and play with the little one like this, or you move the kettlebell with a rounded back, and you're spending 9 hours sat at the desk without moving, you don't make some adaptive changes, then you're continuing to abuse your back. It's not difficult, it requires a bit of time, but some simple things like looking at your desk setup. Do you really have to sit there for the whole day? Could you maybe sit stand? Could you have a sit stand desk? Could you take breaks, maybe take phone calls and walking around more? Could we use a simple shoe horn to put our shoes on and off? That very inexpensive investment can save you having to round your back to go down. Now that is a peculiar one, because that's not a solution. That's a temporary fix, because if we get our hip flexibility in place and in the right place, then we're not going to have any trouble bringing the leg up to put the shoes on. It's not going to involve us rounding our lower back over to try and get down there to put the shoes on. So that's kind of a double-edged sword kind of approach there. And then just trying to be more conscientious. If you're out in the garden, you're doing things in the garden or around the house, or you're going out to get back into that hobby that you enjoy, you're thinking about your back a little bit more. You're using some of the tools. We've already mentioned a towel. Hopefully many of you will take away from that when I'm sitting in the car for long journeys, I should put one of these in my lower back. Those little things are implementable immediately from today. Now, you're not going to think of all of them in one go, but just try to start to be a bit more aware. And that's why education, that's why in the Back in Shape program, we mentioned those 300 plus videos. A large amount of those are education, because the education, you've got that for life. You can stop doing all those things and modify those other things to make immediate improvements in the healing and recovery process and massively shift the odds in your favor of a long-term recovery. So don't stress yourself out about making these changes all at once, but in absence of these changes. And I always remember this one lady that we had come into the clinic for decompression, and we did her neck, and her neck, it was very, very bad. It was bending the completely wrong way and not good. And we discussed how she'd had so many different treatments all around the world and they hadn't worked for her. And I said, look, this is what's going on. You've got to change the way you're doing things. You've got to stop using the phone the way you're using it. Hold it up at eye level, etc. Yes. Great treatment, felt great. We did a great work on the treatment table. Absolutely fantastic. She walks out to the lift and I catch her. She didn't ever see me because I didn't say anything at the time, so I said it next time. I catch her on her phone, like that, straight after, right after we've had a treatment, decompressing the spine, done work to the cervical section. And exactly the same thing is relevant to the lumbar spine. You have to make changes. If you don't make changes to the way in which we're doing things on a daily basis and start to think a bit more, we're going to really, really struggle. So I must stress that importance. It's great that we've been through all these exercises and things, and hopefully this presentation has been really useful for you to date and you've made some great notes, but you've got to apply what you're doing in your exercises to the real world. Otherwise, you will really struggle. So what are the action steps now? Now, if you've made it this far, congratulations on coming, all the way through here. I do hope it's been really good and well done to you for getting this far. And I just want to say, we saw some of the really struggling people in the clinic. We've had a lot of experience with people who have really been in a bad way, to the point of some getting spinal implants. For those of you that don't know what that is, and this was only a couple of occasions, thank God, but it's where we basically have wires plugged into the spine up here and a little device that's implanted just underneath the skin down here. And whenever the pain's too bad that you can't manage, you have this little device kind of like the size of your phone or a bit smaller, and you just press it over and it kind of uses near field communication to send a signal into the spine to try and block the pain. Those devices, you can imagine someone's in a pretty bad way before they go and get one of those fitted. And the reason I mention that is we saw a lot of people in person in our clinical years, some really, really struggling. But what we also have seen since is actually members of the program, again, just like with the clinical patients, they'd come to us from many parts, not just the UK, but further afield as well, to try and get the help that we offered. But we have the same thing with our members. We have now members all over the world that are getting help. But one of the things that's so good about this, what we do now, compared to maybe just that clinical approach that we had in the past, is the level of empowerment. We talk about education. Some people that do this, and maybe they've already left this presentation, but not you. They skip bits of information. They don't want to invest in it. They just want that exercise quickly to go and do that thing. But actually this empowerment coupled with support and helping guide you along the way, is a much more collaborative approach. And really, that is the future of helping people with back pain. That's really what we need to do going forwards, and work as a team to help guide you. You do the work and we guide you. And to that end, obviously, many of you who are joining this know we've got the full Back in Shape program. Now, this is a ton of information and it'll get you going really well. And hopefully you made tons of notes. And you can really put that into action over the coming days and weeks. But for those of you that do want a little bit more help, we do have a special offer for you to join the program. I'll go through a few of those details and I'll have some stuff on the screen so you can read a little bit more. And again, in that email that comes out after this, keep an eye out for that. We'll have some links there as well so you can get started. But I want to draw your attention to two key things about the program. Yes, we've got the program itself and all of the exercises and the videos and the education and all of that stuff going into even more than what we've already discussed today, giving you absolutely everything that you need. But every single week we do a live coaching call, not dissimilar to this, with all of our members to field their questions, go through demonstrations, answer questions, give them guidance and advice on when to return to certain activities, because at the end of the day, you want to fix your back pain so you can get back into doing the things you want to do. And we do that every single week. And within our private group, we support members along the way on their journeys, whether it's giving them advice around flare-ups that they might have, challenges that they have with the exercises, reviewing some of their exercises, queries on different devices that they've seen online, various different things. That's how, for some of us, for some of our videos, we've actually discovered through members bringing to attention certain devices, saying, hey, Mike, can you review this? Laura, can you review that? And tell us what you think. And we look at it and go, actually, that's really good. You can use it like this. There's that support there. And that support has is a way of guiding you along the way. So there's two ways you can get into the program. Number one is we're offering you guys a 7-day free trial when you sign up with the 28-day billing method. And again, just on the screen here, you've got the details and the details sent to your email. That's option number one. So you can get in, have a look at everything. You've already got a ton of information from here, but that will be even more and really benefit from the support. Join us on that first weekly coaching call. Join us in the private group so you can see exactly what it's about. And that can give you that support that you need going forwards from here to make sure that you get the results that you're after. And for those of you that do want to really commit and move forwards, we have the yearly billing option. That's for those of you that, you've had this a long time. It's going to take you some time and you're committed to getting things going. Not only will you save £200 or about $250 when you sign up to the yearly billing, we're also going to throw in a free call. So that means at some point, and you'll get a link to book this in, some point in the next 10 to 14 days, not straight away, and I'll explain why in a moment, we'll have a free call one-on-one to go through what you've done so far in the program, the background, etc., and make sure that you start in the best possible way for you. It's just to give you that extra guidance. You're committed, you're in it for the long term, and we're in it to help you for the long term too. The reason I say 10, 14 days, 7, 10, 14 days, is because when you sign up, I want you to get in, go through phase 1, go through phase 2, have a look at all the educational material, or a reasonable amount of it, try some of the exercises. Even if you're feeling nervous, have a look at them, give them a little go. Because on that call, it's so much more helpful if you can tell me how you found this exercise, that exercise, what went wrong, what went right, etc. And then we can really help you move forwards rather than going, hey, you need to go and try this, that, and let us know how you get on. It'll be so much more useful for you and really help you hit the ground running. So that's pretty much it from me. We've got those two options to get started with a free trial, or join us for the yearly option and get that free call with us and go through everything to kick things off in the best possible way. I do hope you found this presentation helpful. Hope you've really taken something away from it. And if nothing else, that with a bit of empowerment, you can actually really turn things around in a very positive way. Thanks so much for joining us, and we hopefully see you very soon.